Now it's recording. All right, guys. So I assume some of you have had some SI joint issues. It suits you. Okay, good. The long hair suits me. Good. That's good to know, Sam. Yeah, so you could put a thumbs down if you've had some SI joint issues or any pain you think is associated with the SI joint. Yeah, so we're going to go through some basic anatomy. It can get pretty complicated, I guess, so we'll keep it simple. We'll go through some of the injuries associated with that area, some special tests, and a treatment associated with it. So how we as therapists would treat it and how you could treat it at home and get started with a management program. Anything to add to any of that?
No, Mr. That's Robert. The plan.
That is the plan. So throughout any of this, you can ask questions. So on Zoom, just type them out. And on Instagram, you can type them out as we do the presentation. So I'll look back through it and make sure I don't miss any. I think I've been doing pretty good with that. Yeah. And if it cuts out Instagram Live, what was it today? I forget the day. It's Tuesday, right? Yeah. Mm-hmm. Last week on Friday, it kept cutting out. So if it does cut out, just let us, or just go to our Facebook page or our Instagram last post, and it has a link to access this on Zoom. So that way you can check that out. So without further ado, I'm going to do some screen sharing, and then I'm going to grab that camera and show you just a few slides, nothing crazy. It's going to feel like school again. And then Rob, you can throw anything you want to it as well. So this is this very nice custom presentation I made. It took a few hours. No, just kidding. I just did this today. So the sacroiliac or SI joint, SIJ for short. So that's what I'll use from now on. Actually, let me just add this participant in. Admit. Good. They have been admitted. Uh-oh.
And as far as the name goes, it's simply the joint between the sacrum and the ilium.
Yeah.
Sacrum ilium.
So yeah, so the joint between sacrum ilium bones, which are connected by strong ligaments, also supported quite a bit through musculature. So it's essentially the connection between the spine and pelvis. It connects your upper body to the lower. Very important if you wanted to do anything in life on your feet, involved in pretty much everything we do. So whether you're sitting, standing, doing stairs, deadlifting 1,050 pounds, it's going to be quite involved. So due to this, it's essential for effective load transfer between the spine and lower extremity. So it is something that does transfer the load between the top and bottom half of the body. So due to the fact that it transmits so much load, it is a very stable joint. So we discussed in the past that the shoulder, for example, has maximal mobility. So a lot of movement, a lot of range of motion. And that sacrifice is stability. So it's not very stable. So you see a lot of injuries. It's a pretty unstable joint versus the hip joint. So the iliofemoral joint, yes, that is correct. The hip joint, so the ball and socket joint, that's a very deep socket and a very stable joint. So not as much mobility as the shoulder, but a lot more stability. Now you have the SI joint, very little movement, still does have some movement, but very, very little movement, lots of stability. So a lot of the times with these injuries it's mostly ligamentous or musculature in nature. So ligament sprain or a muscle strain. So a lot of the times I see ligamentous issues, and you'll see in the next slides that oftentimes you don't know exactly which ligament it is because there's so many layers of ligaments, but the treatment would be the same regardless. Yeah, so that was me talking too much again. So here's a picture of the SI joint. So you can see quite a few ligaments all over. It's kind of like a web, right? So it's a mess of ligaments. That's pretty much to show it's just a mess. Right, Rob? So you have the inguinal ligament. You've heard of that before, like inguinal hernias and stuff like that, inguinal strain or sprains. The iliolumbar ligament, like I can name these all day, but the main purpose of this slide is to show you how intricate the ligaments are, how much support there is with that joint. So more ligaments means just less mobility, so more stability. Anything to add about that, Rob?
No, absolutely. Yeah. Very stable joints.
Yes, correct. More fun images. So here's a lot of meat, red meat, so meaning a lot of muscle. So ligaments were the first layer, and then let's go next layer, all the muscles. So this is to show there are a lot of muscles that insert into this area or originate from this area. So I think there's 35 muscles that attach to the SI joint or somewhere along it. So quite a few muscles that attach to it. So then there you go. You have even more stability. Lots of muscle, lots of stability, lots of ligaments, lots of stability. So I'm just trying to highlight it's a very stable joint. So injury can be, so pain-wise, you can find quite a bit of pain in the buttocks area and low back. So this one, actually, they do misdiagnose it sometimes. I think what was it, 17% or 21% of people with low back pain actually have an SI joint issue. So there's a lot of crossover, right? So with this, with the back and SI joint, there's a lot of crossover of pain. So pain in the buttocks can be from low back injury. See it quite a bit. Pain in the low back can be from the low back as well. But the biggest thing is assessing it and seeing with some of the stress tests that we'll go through. It can radiate to the groin, lower hip and upper thigh as well. So causes, we talked quite a bit in the last couple of weeks about traumatic versus atraumatic. So traumatic being a fall, direct impact, car accident. That's an insult to the body that has a clear mechanism. Atraumatic would be like osteoarthritis, which can happen in this region. I see it quite a bit. So atraumatic being over time, more of like a, what is it called? What's the word I'm looking for? Repetitive stress type of injury. Childbirth, pregnancy. So during pregnancy, you have obviously different hormones being released. So one of which relaxin, which does laxin the ligaments. So you can see quite a bit of sprains in this area during that term. During pregnancy and childbirth. This is out of our scope because Rob and I are not trained in pelvic floor women's health, but we will be linking up with somebody soon, hopefully, to discuss more about that. Doesn't mean we can't treat some of these issues, but we do refer to the specialist when it comes to pregnancy or childbirth. Surgery, low back surgery, things like that can affect this area. Yeah, that's the injury part of it. Didn't want to get into crazy amounts of detail with that. And that's it. That's the presentation for PowerPoint, but a lot of this is we're going to go through, we got some more people. We're going to go through some assessment techniques, how a physio would assess you, and then a couple of ways you could do it at home just to distinguish between a low back or an SI joint injury. And then we'll go through a few fun exercises, starting off with some, pretty much ones that anyone can do. It just has to be modified. So some of these things, the stretches, if you don't feel it, we just have to modify how we do it. Lots of different ways to stretch. Yeah, and then I'm going to just quickly look if I missed any questions. No questions, just a lot of waves. All right.
Awesome.
Good.
So as far as the assessment goes, like you could see in the images there, it's a very busy area. You have like the low back, which is immediately adjacent there, and then the hips as well. And of course, lots of those like good, strong muscular supports and ligamentous supports in the area too. So part of the assessment is kind of teasing out which area is the cause of pain. Keeping in mind that like low back pain and hip pain, those can be, those types of injuries, they can kind of cause pain that's hard to localize pretty often. Like the low back can cause pain in like a variety of areas. The hip as well can cause pain like behind the hip, lateral hip, groin, front of the hip. So often it's tough to tell just from pain location which is the involved joint. So as far as assessment goes, like first goal is to kind of figure out which is the main area that we're going to focus in on. Mm-hmm. And then we're also going to look to find if we can narrow it down to that SI joint. Is it an SI joint that's kind of like hypomobile, irritated, inflamed that way? or is it an SI joint that's like maybe a little bit too mobile, or I hate to use the word unstable because it's not like it's gonna fall apart, but
definitely.
But maybe that could benefit from stabilization exercises. So so first off, when we're sort of differentiating the different tissues or the different body sites, I know a lot of physios will use even something as simple as kind of a McKenzie style assessment to rule out like the low back as a cause of pain. So I don't want to go off camera here, but that can be as simple as like having a person kind of perform like repetitive lumbar extensions, either from standing or in sort of a kind of a cobra pose off the floor. And then the opposite as well. So either doing repetitive forward bends, or if you're laying on your back, you can be pulling the knees into the chest. The idea with those ones is that you're moving the low back predominantly. So if the low back is your source of pain, that's going to change your pain in that case. And if it doesn't, that helps us to kind of rule the back out a little bit as a cause of pain. So that's usually something we're going to look at with people presenting with pain around the SI joints to kind of help us to move that aside a little bit. With any kind of testing that we're doing, and this goes for the like clinical tests that we do, but also for like diagnostic imaging, those kinds of things as well. They're going to have different like kind of statistical parameters to them. So a couple key ones we call like specificity and sensitivity. So basically, if you run a test, it's gonna be positive or negative. That's going to tell you information about whether the person may have that condition or may not have that condition. Like for the SI joint, for example, there's a little bit of a list of tests that we'll typically do, at least 4 or 5. And any one of those tests in isolation doesn't necessarily tell us that much. But when we put together the results of all 5, so usually we're going to look to get 3 positive tests out of 5 or 2 positive tests out of 4, depending on the test boundary that you're using. That's going to give us more information about whether they truly do have kind of a dysfunction of the SI joint, or if we can't fully rule that in. So basically, by combining different tests together, it just gives us kind of a better predictive power when it comes to interpreting those tests. So
we can go through those.
Sure. Yeah.
I can be your. Or sorry.
Let's do that. Do you want to head over to the bed for 2 minutes?
Let's head over to the bed. Yes, let's do that.
Okay.
Everybody will want to see some special tests. What we do in physio. I think it's cool. So I can move this. So we have.
Put this guy on the stool.
Yeah. Maybe I'll be the patient.
Sure, yeah. You can start on your back.
Yeah. I'm okay. Everyone can see there, yeah. Make sure I take my shoes off. So,
yeah, no kidding, right? So I'll generally use like a group of 4 or 5 tests, test the SI joint. Since I'm on this side of the bed, we're going to test Sunny's left side, which is on my side of the table. So our first test that I'll always do is called the femoral thrust test. So with this one, we're basically kind of lining the femur up vertically. If anything, we can have the knee crossing the body just a little bit, or in a little bit of horizontal adduction. Sunny's a tall guy, so get the bed height proper for me. And with this test, all we're doing is putting like a vertical force down through the femur. And this is going to be kind of our first stress test for the SI joint. All we're looking at on this one is the presence or absence of the person's pain. Any pain for you there?
No, but I don't have it.
Yeah, no kidding. Just gonna rest your upholster.
Nice laid down.
Don't get stuck there.
I could do this all day.
The second test we'll also do from this position. So keeping in mind that SI joint was sacroiliac, and the kind of the iliacus kind of being the crest of the pelvis. So for this test, we're going to put pressure forward to back through those iliac crests, through kind of a bony point on the front of the hip called the ASIS. So this test is going to look just like this, and again with a downward pressure. Again with that one, we're just looking for the presence or absence of pain. Yeah, you're always going to want to explain what you do to the patient, especially when you're poking around this area.
Oh, it's all good.
Yeah.
And the big thing is the recreation of the pain. So the pain in the back or the buttocks area. So with this special test, a lot of people can get some pain in the front here where you're pushing. So we wouldn't indicate that as positive just because that's from the pressure. So.
Exactly, absolutely, yeah. So you want to make sure that if you're getting a positive test, it's that patient's pain that you're reproducing. I'm going to get you to lay on your right side if you don't mind. Just facing that way. Perfect. For this next test, I would be around in front of the patient, but again, we're just pushing through the pelvis. This time it's going to be, again, a vertical force down this way. And again, with this one, we're just sort of moving that SI joint and looking for the reproduction of Sunny's pain. That's 3 so far. Is that 3 so far?
Yes.
For the next one, I'll get you back on your back.
Back on your back.
Back on your front. Out of the 5, this is my number 5, my 5th favorite out of the 5. This one's called the Gainsland's test. And with this one, you would have the patient maybe not in jeans, but you're just pushing them into full hip flexion. And again, looking for their pain reproduction there. And for our last one, I'm going to get you on your front. And this one, really simple, it's called the sacral thrust test, and it's exactly what it sounds like. So we're going to palpate for the sacrum, which again is the very base of the spine, and all we're going to do is put a vertical force down through it here. So these are all stress tests for the joints. So for each of these, we're going to be looking for the person's pain to be reproduced. Yeah, so those are my favorites. Do you have any other ones that you want to?
I guess there's the figure 4 or vapor stretch.
Yeah.
That I've done, or I tend to do. So just coming back and having your leg just like a figure 4, and then the therapist can push down, and if that irritates the joint, then that would be positive as well.
Just like that.
Me, it's just my adductors or groins, so that wouldn't be positive. That's one that I throw in.
Yeah.
As well. So I think these are all provocative tests. So the idea is if it is an SI joint issue, then it'll present in a positive test, meaning positive for pain. And then you said, Rob, 3 out of 5 tests, right?
I think it's 3 out of 5. 3 out of 5. Gives you like a 0.78 specificity.
Yeah, and that's pretty good for special tests, right? So you look at imaging, then yeah, you can see some osteoarthritis and things like that, but at least this way you can save yourself the visit. And then a lot of times with ligamentous issues, imaging doesn't show anything. So it doesn't mean nothing's wrong. It just means that the image that was used or taken is not as sensitive or specific or both.
That's right, yeah.
I guess we could head back. Should we head back to the...
Let's head her back.
Let's head her back. So, does that make sense, everybody? Pretty straightforward, I think. Not too difficult. So a lot of that is the integrity of the joint, so stability. And if that's positive, then, well, you know there's something wrong in that region, right? So you know it's an SI joint issue or stemming from that. And I find a lot of low back issues kind of cross over quite a bit. So in either case, it's going to be good to treat. Like you're not going to, if you don't know exactly where it is, the issue, like the exact ligament, the course of treatment is always very similar. It's always trying to get the pain-free mobility and then go from there to strength and stabilize. So based on that, we'll go through some mobility exercises. Anything else you want to mention before we go through the exercises, Rob?
No, I don't think so. You'll sometimes see, like those were all kind of like provocation tests for the SI joints. You'll sometimes see people do also, kind of tests for like the quality of movement.
Yeah.
Like kinetic test is one, for example, that'll sort of look to assess how things are moving around the SI joints.
Yeah.
Like we talked about, it's a very stable joint.
It's like
the thing you might see.
The active straight leg raise test where you provide compression and then alleviate the pain, then
Right.
you know it's
That's when I should
yeah.
come over there.
That's a good one too, a straight leg raise. So at home you could do a straight leg raise, so laying on your back, lifting the leg up. Okay, it's painful, and then if you're alone, you could try to brace your core and then try it, if that helps. I mean, that could still be a low back issue, but then you know you need to do some more bracing exercises or activities. So yeah, that's a few things. And any questions about what we just talked about before we get into the exercises? In that time, I'm going to grab a mat and a kettle. No questions yet. So I guess we'll go through some exercises. So if this is for individuals that notice some issues in this area, again, if you have very high pain, then go get some help right away. If you can't walk, things like that. So this is for people that have had SI joints in the past and still experiencing them, but I guess more moderate pain symptoms. So we're going to start off with some easy ones that everyone can do, anyone can do, and then kind of go from there. The strength stuff is where we might take it a bit easy. You just want to make sure if you have pain with range of motion, then you don't want to do these strength exercises. But the first bunch, anybody can do. We miss you too, Andrea. We definitely do miss you. So hopefully we'll be back to treating everyone soon in like physical form. So I'm going to point this down so you can see the mat. And then we're going to point this down as well towards the mat. So there's Rob there. So you could do a couple stretches if we like. You could do like a child's pose and a glute stretch, I guess. So
Yeah.
Rob can demonstrate this. So he's on his knees and just bending back as far as he can go. So where do you feel the stretch on that one, Rob?
A little bit of low back.
Yeah, so this does stretch a lot of the tissues around the low back and SI joint. This would be like a pain relief kind of stretch. So if someone's in pain, this could help manage the pain. So the strengthening ones, for example, aren't pain relief. They're just to strengthen the area, whereas these ones are to manage the pain throughout the day. Next one, we got a glute stretch. So Rob's got his left leg bent and going towards the opposite direction. So his left knee is going towards the direction of his right shoulder, kind of in that vector. Yeah, you can see it on both. So then where do you feel that stretch, Rob?
Right back here.
Good. So in the glutes, SI joint area, you can get some pull into the low back as well with this one. So the first one that we did in this one, 30 seconds, 3 times. So the first one, 30 seconds to a minute hold 3 times. And then for this one, 30 seconds to a minute hold on each side 3 times. And you can do that a few times a day. That's a pretty good one. Any other ones? Stretches, Rob? Or?
Even like a knee to chest stretch.
Yeah,
Nice one.
knee to chest, another glute stretch, which is very easy and effective.
Yeah. You can do like your figure 4 that you were showing
Yeah.
there as a test.
So that's a good one
Also
too.
stretch.
A very good stretch to do.
Or that.
Yeah. Stretching the groin out. Because with the SI joint, like you could include groin injuries to that, the inguinal ligament is in that region, so a groin sprain to strain. So there's quite a few different injuries that can be with the SI joint. We're just going through like a general program. So all those are safe to do. And especially like even runners, like that's a really good stretching program to do. So you prevent stiffness and things like that. So there's a few nice stretches. You can also grab like a small ball and roll it around your glutes. So if I grab a ball for Rob, I'll throw him the ball. Oh, good catch. So if he's got pain kind of in that glute area, just showing my butt, but if he has pain in that SI joint glute area, I like trigger point release. I think Rob likes it too. So where he has the ball is in his glute area, and when he finds a spot that's local to pain, then he leaves the pressure there. Looks like he found a tender spot, so 3, 4, 5 out of 10 pain, and then you let it release, so kind of the muscle itself releases. and then go to the next spot. So if you don't have access to dry needling at home like we do, this is a trigger point release technique, which is very effective. I do this kind of stuff every day. My issues lie in my hip flexor, so the front of the hip. So I roll around there, and then my low back and mid back and neck. So yeah, very good, effective thing to do. People often like underestimate how effective these things are, but they're very important to do. So strengthening, we could get into some if Rob wants to.
Yeah, sure.
Do those as well. So you could do like a bird dog, dead bug.
Yeah.
Combination. So I can let you explain those if you like.
Yeah. So I mean, like any joint in the body, if we have issues, we can be looking at any patterns of like muscle tightness or muscle weakness in the muscles that cross the joint. That's kind of just a framework to say that there's, like we saw on the slide earlier, lots of big muscles and muscle groups that cross the SI joint and impact it. So kind of, yeah, as a result of that, there's lots of different exercises that can be effective, like based on an individual's patterns of tightness and weakness. But yeah, so the bird dog is an exercise that looks something like this. Different variations can include like hip extension or hip extension with an arm lift. Basically with this exercise, we're kind of working the muscles that are active on the kind of the right glutes, and then also kind of like the opposite muscles through like the left thorax and posterior shoulder, and they kind of work as a sling together from right to left as you go up. So, anyways, with the bird dog, you want to make sure that you're as stable as possible, like through the low back. So often people will kind of like lift that hip, trying to bring that leg back further than they can just by a hip extension. So you can even get people to sort of try balancing like a soccer ball back there. And if they're kind of off kilter, they're going to lose it. Is a way you can kind of self-check and make sure that you're stable there. That's the bird dog.
Awesome.
You want to teach me the dead bug?
I could show the dead bug,
Yeah.
Or no, I can teach you if you want. So dead bug, same kind of principles. We want to brace, right? So this is a way to start strengthening in these safe positions. If you're laying supine or on your back like this, very stable. Same with when you're on your hands and knees versus when you're standing, right? So standing, a bit more instability. So this is where you start. So you do those stretches, and you start with these strengthening exercises. So I always say start with just 2 joints. So if you do the leg extensions with the first one that Rob showed, and that hurts, then just try doing the shoulder extensions. This one, I would get Rob to move his hips and knees at 90 degrees, so come up like this. If that's starting position for the lower extremity, lift up the hands, good. So this is starting position. So what Rob's gonna do is he's gonna push his back down towards the mat, and you can put a towel roll underneath your back just to make sure you're feeling it where you should. So he's pushing down. You're going to strengthen your core automatically with this. You're going to tighten it up, so I'm not going to tell him to tighten his core. And to start is you just move one arm back, an extension, and forward, and then the other one. Okay, that's easy. Rob's pretty strong, so now we're going to do the legs instead, and then move one leg, and then back up. Big thing with this one is you stop moving the leg before you move the other one. Sometimes people do like a bicycle thing, which isn't bad, but I'd like to keep the technique consistent. So if that's easy, then you do contralateral movement. So opposite knee to opposite hand, right? And back up while he's keeping his back pressed down. Very good bracing exercise. Again, these ones will start a lot of people on whether you're just sedentary or like active twice a week or an athlete. I'll do this. And the difference between activity levels is someone who's a bit more active might get the hang of this faster, then we can progress to other things. But anyone can do it, right? So if someone who's sedentary and then starts getting more active through treatment, then we can progress to some of the other ones we're going to show you. So that's a good one. Another stretch I forgot to mention, is if Rob's right here, actually, a little back rotation stretch. So having his knees like this and then just rolling. So he's trying to keep most of his back in contact with the mat and just trying to rotate the low back hip area. So this is a way to stretch the glutes a bit too. Mine get a good pull there because they're always tight. Yeah, so that's a good one too, just throw in there. Same thing, 3 times 30-second holds. For the dead bug and bird dog, you can do like 3 sets of 7 or 10. What I typically do is 3 sets to burnout or fatigue. So once your form deteriorates, that's when you stop. So whether that's at 5 or 6 or 7, that's how I do it. But you could do, you know, if you know 7's difficult, then stay within the 7. That's a couple more things there. Okay, so now we're going to come back up. So those stretches, those are some stretches and strengthening stuff to start on. So let's say you do all those, all good, you're bored, you don't like doing them. You want something more challenging. There are more ways to make those ones challenging, but more functional stuff I like to show is doing some like single leg RDLs, Romanian deadlifts, or doing some good mornings. So those exercises are great because you're focusing on multiple segments. You're focusing on the hamstring area, you're focusing on the SI joint, and you're focusing on the low back and core all at the same time. So the goal is to make those contractions that we just did. So doing the bird dog and dead bug, trying to get those muscles engaged. So when you do these next exercises, you're cueing those, like those muscles are already cued. So anything to add about that?
Nope, I don't think so.
So good morning wise, I can show you one way of doing it with the dowel. So the way to start the good morning is using a dowel. If that's too light, then you could use a barbell, right? So if you don't have access to a barbell, then you can use this with bands on the sides. Not a bad idea. I can grab some bands to show you. So, good morning, back strengthening, hamstring strengthening, really good exercise to do. Yeah, you don't need to see my face. Actually, I'm gonna raise this up a little bit. That should be good. Good. So, what you got is dowel. It's on my back. So my knees are bent a little bit. So like an athletic stance, so a small bend in the knees. What's going to happen as I go down is my knees are not going to change in position. They're not going to bend more. They're just going to stay a little bit bent. So what I'm doing is, I like the dowel because it keeps my back straight. I want to stay looking forward. I don't want to kind of look down as I go. So what I'm going to do is bend the knees a bit, and I'm going to hinge at the hips. My back is straight the whole way, and I come back up. So I try to go to about 90 degrees and back up. And I always tell people, instead of shifting weight on your heels and sticking out your butt more, you want most of your weight to go through your forefoot or toes. So right now, in this position, I can lift my heels up pretty easy. There's not much weight on them. Come back up. If you get too much on your heels, you can fall backwards. People don't usually fall forwards. Their body naturally just kind of keeps itself up if you put too much weight on the forefoot. So coming down and then back up, down, back up. Usually sets of like 6 or 7, 3 sets. This one I wouldn't do till burnout because you don't want to strain things. So as long as your back is straight and then back up. And a lot of people I start with the dowel and it's a bit more difficult than you think it is. What you could also do, if you don't have, what do you call it? A barbell, you could put a band around the dowel. Hopefully this works.
See how strong you are.
Right, and then hopefully this doesn't. All right, so now I have my resistance, right? So now I come back and back up. Down and back up. Down and back up. So now I actually got some resistance, right? So what I'm gonna do is take it off without getting nipped in the face. That's one way to do it. If you have access to a barbell, then you can definitely use a barbell. And then you can add as much weight as you want. You want to progress this slowly. So once you can do 7 to 8 reps with not too many issues, then increase the weight. Don't go very heavy right away because it's a good way to get injured. Very good way to injure your back if you're doing it inappropriately. So again, I guess you could say this is a more advanced exercise. Yeah, so that's another one. And another fun one that I like quite a bit that Rob likes quite a bit too, I think, is like a single leg Romanian deadlift using something like a kettlebell, or a dumbbell will work too if you don't have access to kettlebells, milk jug, whatever you like. I like kettlebells because it has like a nice handle to it. So what I'm doing in this one, same kind of starting position, right? So you're gonna have a slight bend in your knee. And I always tell people to run the bell kind of along their thigh. That way they're not going too far forward and then hinging, putting more pressure on the low back. So what I tell people to do is, so if I'm starting on my right leg, I come back down. Let's see if I can, and then back up. So I'm not even going down all the way. The big thing is to keep the back leg straight and hinge down and try to get the bell to the floor, and then come back up and try to keep the back flat at the same time. And then back up, just like that. Again, doing sets of 5 to 7, and then just kind of hinging down, back up slow. Normal places to feel both of these exercises is low back, glute, and down the hamstring. So doing good mornings and Romanian deadlifts, good exercises to do for more advanced stuff if you wanted to get into more advanced exercise.
So, or even like preventatively for those ones.
Yeah,
right?
sorry, yeah, very good. Some of the athletes I work with, yeah, it's in their warm up. So they'll grab, and this was like what is this? A 13-pound dumb or kettlebell, so 6 kilos. So a lot of athletes use this in their warm up programs. I try to get these in good mornings done a few times a week, and they've strengthened the back quite a bit. Mm-hmm. So they'll cue the muscles, fire them up, and then when you do your activity, the hope is less injury, keeping the area stable. So I think that's a good breakdown of the SI joint.
I think so, yeah.
Any questions about it? So anyone that has had an injury in the past or still going through some pain and wants more clarification, you can type it out on Instagram or type it out in Zoom. So oftentimes, like an area that's people think is difficult to treat just because it's not covered too much in school, or the thought is it's not covered too much through school, but a lot of the stuff you learn from the low back can cross over
for sure
into this. So it's not like you need to learn a huge amount of theory about it, because it's hard to distinguish between like individual ligaments in this area, right? Versus the ankle, for instance, mm-hmm. which is another good topic to do. So a lot of crossover between it. So if you know if it's a stability issue, lots of ways to strengthen it. And then if you try something and it hurts more, then you just try something else that's easier, right? So if you start doing the good mornings and they hurt really bad, then get on the floor and do a bird dog or dead bug and start off like that. Any questions either on Zoom or Insta? We still got some time, probably about like 10 minutes, but if we need it. So typo questions about anything about that, guys, if you have them. So it's not like I'm calling you out to make sure you ask questions, but now's the time to ask.
Yeah, but it's all pretty straightforward. Like testing wise, you're gonna first try to determine that it is in fact the SI joints. Although like we said, like treatment, there'll be a lot of crossover between the low back, SI joints, and hip. Yeah. And if you find that it is SI joints, tests can be done to see if maybe the area needs stabilization, or if it's kind of that like more hypomobile, maybe like osteoarthritic SI joints that doesn't have maybe enough kind of flex to it. Then you might be looking more along the lines of like mobilizing or like stretching the area.
Yeah.
To kind of increase mobility versus increasing stability.
Yeah.
But you want to have both basically.
Exactly. And then this question kind of ties into that. Something that was mentioned in school was the concept that the SIJ is practically fused in adulthood and doesn't actually have a lot of movement. Shout out to Jeff Bostick.
Nice.
What do you guys think about that? I could agree with that. I mean, Jeff is the guru, so you can't say anything against him. But I think like what he's trying to mention is it's fused in the context of like there is very little movement, right? So I think it's so minimal that like you could consider it fused. Yeah. It's not like we're trying to do
like when I mention mobility, that's more so like more muscle tension and things like that, ligamentous pain. So mobility through the hips, but to, you know, stretch certain muscles and get things more mobile that way, not mobility directly of the SI joint, just because you can't really appreciate, like if I'm pushing down on someone, I'm doing a posterior anterior test on the SI, it's hard to know, right? A lot of that movement is soft tissue, and it might be the hip that's not level. So if you're just pushing down, the other side's coming up. So you might be like, well, this is hypermobility, right? So most of the time you're dealing with, like, it's still a joint, right? It still has synovial fluid. It still has a capsule. It still has a little bit of a gap, hence the arthritis. If it was truly fused, then you wouldn't really have osteoarthritis like in that area, I would think. But so yeah, you could say, yeah, it's not moving very much. So I agree with that. And that doesn't change the course of treatment either. So if you think of it as fused, you're still going to treat it the same. You're still going to try to manage that pain right away, and then strengthen and stabilize that area.
And I think about it the same way. Like, I think that's like why we kind of went through the provocative testing versus the like the kinetic testing, where you're trying to see, and you'll hear people talk about the SI joints and like nutation, counter nutation. So movements of like the sacrum with respect to the ilium. And like was mentioned in there, like for a lot of people, the joint does eventually fuse. And even before fusing, like it's debatable, like I think how much movement there is in there.
Yeah.
And like based on what I've read, like those kind of kinetic tests assessing for movement don't have very good like kind of intra-rater reliability. So if I were to assess Sunny's SI joints today, and maybe I would say like one side isn't rotating as much as the other one.
Yeah.
I think lots of the evidence shows that those tests aren't like well reproduced. So if I were to assess them a week from now, there's a good chance that, I don't know, I might come up with different findings.
Yeah.
So it just makes you wonder, like, what are you feeling? Like, is it, like you said, does it kind of change the treatment course?
Yeah. Yeah, that's the thing.
Possibly not in that case.
Like, know that it's a ligamentous issue, or if it's a muscular issue. And then if it's osteoarthritic, so less joint space, then you know you need to strengthen and stabilize to reduce the impact through that joint, right? So, and that's shown for the SI joint and the iliofemoral joint, the hip joint. Research shows that strengthening it does decrease the joint impact. So if it's osteoarthritic, it's fused, then you need to strengthen. If it's not fused and it's not stable in terms of the ligament, like stability, I refer more to it as ligamentous than the actual joint. So if it is a ligamentous issue, you still need to strengthen, but you need to get that pain-free range of motion first. Yeah, and then we got another question. Can you roll on the ball directly on the SI joint? You can. That's going to hurt. That will likely hurt pretty bad. So I would say if you roll on something, I always try to avoid direct bone rolling. So if you're rolling your back or SI, once you get into that bony tissue, it's going to hurt no matter what. So my thing is, if you do it on something that's not supposed to be rolled, what's going to happen is after 30 seconds, it's going to be more painful, or it's not going to change in pain. You need to move on. The pain should go away, so to speak, in like 20 to 30 seconds. So you don't want to roll directly on the joint, but I would roll around it. So more of the meaty areas, like the soft spots. I'm sure you would agree, Rob.
Yeah, like there's a lot of muscles between the skin and the SI joint.
Yeah.
So you're never going to be, you're always going to be rolling through something.
Yeah.
Which is good. That's where the effect is anyways.
Exactly, yeah. Thumbs up on that. Any more questions? Give it a couple more minutes, and in that couple of minutes, we'll talk about what we're going to do for the rest of our day. What about you, Rob? What are you doing today, this afternoon, whatever time it is? Almost 1.
Yeah, I don't know. A little bit of maybe write a blog post.
Oh, nice.
Yeah.
Oh, we have one already ready to go, guys. We're just trying to get a good picture for it. So I promise, Brooke. It's all ready to go. I just need to find a cool picture. And then, if you have any blog ideas, let us know.
I'll do another
if anyone wants
5K this afternoon. I'm trying to give myself a running injury so that I can blog about it. I think I'm close.
Give yourself some shin splints. A real pain in the shin.
Yeah, we should take bets about what part of me will break down first.
Oh gosh, I'll join you on
Could be the
that.
shins.
Those provocative tests would be targeting the joint itself, correct? If you thought it was muscular in nature, sorry, let me see here. If you thought it was muscular in nature, do you still tend to see those tests be positive?
I think like if you have like this, if those tests are giving you like joint pain, you have to think about is there like a muscular imbalance that's like leading to that dysfunction? So in that sense, you could be like treating the muscles in order to like restore function of the joints.
Yeah.
So there could be a connection that way. But if it's something like I don't know, like a proximal hamstring strain, for example, which could give you like pain, like kind of close to that. This is my kind of SI typical pain pattern, and this is kind of my proximal hamstring. If it's or like say like if this is kind of SI, if it's kind of like a gluteal tendinopathy, or something that's like really like a muscle injury, then I would not expect to get positive tests with many of those. But with that being said, like a lot of those tests, they'll kind of stress the area. So you might get pain with one or two of those if you're pushing around in there, which I think is why it's important to kind of consider them as kind of a battery of tests as well.
Yeah, that's important. And if it's muscular, then you're testing active range of motion and strength before you do any special tests anyway. So if it's like an adductor, like a groin strain, then you're gonna be pretty clear. You're gonna be pretty sure of that before you even get to the special test, whether you decide to do them or not. Mm-hmm. Like a Faber stretch, for example, is going to be painful for an adductor strain. So I think the special test helps you rule in things, but like I know with schooling, and when I was a student, I always wanted to learn the cool special tests, and then you realize, yes, they're important, but the active range of motion, passive range of motion, and strength testing is more important than everything, right? So like a shoulder, for example, those provocative special tests, like if it's acute, everything will be positive. You'll have bicep tendonitis, you'll have supraspinatus, infraspinatus lesions, you'll have it all, right? And then you'll actually let the pain go down, treat it acutely, and then you'll do those tests again and figure out, no, this is something else. So I think your basic test will tell you more than you think sometimes.
And you also you want to be careful about over testing sometimes too. Yeah. I think sometimes there's a temptation when you know all these dozens of tests to do them all.
Oh yeah.
And I think the more, since a lot of the tests are provocative for the tissue that you're testing, the more provocative testing you do, the more you're gonna maybe get false positive tests because you're just making the person really sore.
You'll fire them up, so to speak.
So for the SI joint tests, for example, some guidelines have said that once you get 2 positive tests, you don't need to continue. So if I had a positive, maybe my femoral thrust and my compression test, I don't need to go through and test in the other 3 positions because I already have enough information to make my diagnosis. So.
Yeah. No, that's good. That's a good question too. Hopefully that answers that. Hopefully just don't go around in circles and not actually answer the question. Yeah, I think that answers that. Any more questions? Thumbs down, Brooke, if that answered it, or thumbs up if it did. Or nothing. That's a good.
My grandfather always used to say, "Oh, my aching sacroiliac."
Oh,
I
wow,
never
really?
Meant for a long time.
Aching sacroiliac.
When I was a young kid.
That's awesome.
I remember him saying that a lot.
Yeah, thanks. Okay, good. With a slightly tanned thumbs up, so it looks like you got a tan on that nice trip that you took.
Is that Brooke?
Sorry, it is Brooke. I thought I'd just throw it out there. Yeah, any more questions? We got a couple more minutes. And even looking at pregnancy and things like that, a lot of stability exercises are shown in different ways. So hopefully we get a pelvic specialist to go through some things next week in slightly different ways. Those are things that I wish I could comment more about, but don't want to say the wrong thing. Not to say I haven't treated women who are pregnant, but with good success. But that was for those kind of issues, more on the back and SI joint. Yeah. So tomorrow will be, oh, sorry for who just joined. Tomorrow will be TMJ, so the temporomandibular joint and dysfunction. I'll get busy presenting slides. And then we'll go through some things. So I know a lot of people have clicking, popping, that kind of stuff. So it'd be nice to show you the mechanics behind that joint, why things happen the way they do. And then Thursday we have Brandon for pain science part 2. And then we have Friday's like running injuries. So we'll go through some knee pain and some shin splints. So those are the things that were offered up. And if there's more suggestions, please let us know. If we have to do another month of this, we need like quite a few topics. So
It'll be getting obscure by the end.
we'll just do repeats and be like, oh, here's SI joint. Wait a minute. We already did this. So yeah, make sure you give us feedback. We like that. You can tell us if we're boring or not. Hopefully we continue getting people to watch this. Spread the word. We'll get 1,000 viewers live. That's the goal. That's my PR. I want that PR. So yeah, let us know if you need anything else and give us some feedback. Thanks for attending, guys. We appreciate it quite a bit. So we'll get through this. Go, Rob. Rob says bye.
Bye-bye.
Let me end now. Okay. And that's ended for us. What the heck? End
Is it the
meeting.
door